Okay, so let's finish up with alterations in GI function, that is section 6 of part 2. In dysphagia, there are no fresh changes. Dysphagia is same. In nausea and vomiting, and indigestion, starts with the treatment part as usual. Here in the treatment of nausea and vomiting, in antiemetics agents also they have added a lot, like a neuropathic modulator. Cannabinoids was in special settings. It has been taken up to antiemetic agents, and prokinetic agents also added a lot. Special settings also added a lot. So the table 45.2 is very important. A lot been added, and also the other clinical settings. This was not there. There was a special setting or something like was there. It is now other clinical setting, and this whole paragraph is very important. They have added some of the more important things. And indigestion, there is not much in indigestion. Only thing is the very important thing. They have given that upper endoscopy is recommended as the initial test in patients with unexplained dyspepsia who are more than 60 years. Earlier it was more than 55 years, and this whole paragraph till the treatment part is very important. You have to read it again. There are slight changes, not much, but age is absolutely changed. It was more than 55 earlier, and now it is more than 60 years. And other than that, everything else is same, and treatment part is also same. And very important thing, another thing, sorry, the in treatment part, indigestion, they have taken the low FODMAP, that is for IBS, has been taken in this part of the first paragraph of the indigestion. And as you know, the other options, and in the other options there was saying that the FODMAP or FODMAP diet is not useful, but that thing has been removed from here. Many of the things are removed, like here also GABA abonixt baclofen reduces esophageal exposure to acid and non-acid fluids by restricting temperature by 40%. Before that there was like antiemetics, all those metoclopramide were are not useful or rarely useful. That statement has been removed here. There are few statements which have been removed in chapter 45. So 45 chapter, if you read it again, it will be better. And also in 46 they have added a little more in the starting point, like the constipated, the data has been rescheduled, and more of the data has been given in the basics. And then is the normal physiology is part is same. This very important is that the figure 46.1 is very important. There are new antagonists have been named here, and the same thing has been quoted here in the paragraph also. So go through the figure 46.1, 45 and 46, both have to be read for new additions. Other than that, everything else like acute diarrhea, chronic diarrhea, treatment part, nothing has been changed. Nothing has been is actually untouched, clearly untouched. So primarily in the GI section, that is section C, only 45 and 46 chapters have to be read. Other than that, GI bleeding, here also there is no change in even age, and this Glasgow score, and these are all not changed. Jaundice, no change. So similarly, as I can see, because we are doing gastro in the discussion, gastro also similarly, in gastro there is no change at all. Even hepatitis, or even I don't know, maybe endoscopy and all would have changed a little, but as such liver diseases is not at all changed. Similarly, till section 7, in section 6 there are only 45 and 46 chapters which have changed. Otherwise everything else is same. So I will meet you with the section 7 in the next